Zenon, wake up, buddy. Call 911.
The primary assessment is a simple way to quickly identify a life-threatening condition is present. It's the initial approach to anyone suspected of being ill or injured. Before anything else, pause and assess the scene for hazards. If the situation is dangerous to you, do not approach. If safe, begin by checking for responsiveness. Tap or squeeze the shoulder and ask loudly, "Are you all right?" For an infant, tap the foot. If unresponsive, have a bystander activate EMS and get an AED. If you're alone with an unresponsive child, use a mobile phone, if available, to activate EMS yourself. The speaker function will allow you to talk with the EMS dispatcher and provide care at the same time. If you need to leave the child to activate EMS or get an AED, provide about 2 minutes of CPR before you go. Return as quickly as you can. Quickly look at the face and chest for normal breathing. Take no longer than 10 seconds. Normal breathing is effortless, quiet, and regular. Weak, irregular gasping, snorting, or gurgling sounds can occur early in cardiac arrest. These actions provide no usable oxygen. This is not normal breathing. If you're unsure, assume breathing is absent. If the child isn't breathing or only gasping, perform CPR, beginning with compressions. If the child is breathing normally and uninjured, place him in a side-lying recovery position to help protect the airway. Place the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg just above the knee and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the child toward you in a single motion, keeping the head, shoulders, and body from twisting. Make sure the head ends up resting on the extended arm. Roll far enough for the child's face to be angled towards the ground. Make sure there's no pressure on the chest that might restrict breathing. The recovery position helps protect the airway by using gravity to drain fluids from the mouth and keep the tongue from blocking the airway. Frequently assess and monitor breathing. The condition can quickly become worse and require additional care.
Hi, come in.
Hi. Thank you for doing this on such short notice.
Oh, no worries. Hi, Janessa.
It shouldn't be too long, just a couple of hours.
Okay, well, we'll just have to keep ourselves busy, huh?
Yes.
Is it okay if Janessa has a fruit treat?
Sure.
Okay. So come on in. Let's see. Here you go.
Thank you.
You're welcome.
Should go until about 4.
That's not a problem. If you're running late, don't worry about it because I don't have anything planned for the day. I'm not saying that you can go take it, but don't worry.
It just really depends on Jen.
Backed up there at Delta and Beltline.
Would you like me to bring you some dinner?
Well, that's so nice of you, but we're fine.
Okay, goodbye, sweetheart. Love you.
Hey, let's go play.
Have fun.
Janessa, I made you a snack. I thought you might be hungry. Janessa, are you sleeping? Janessa, can you hear me? Are you okay?
911. What is your address?
414 Conde Drive.
What is your emergency?
I've got a little girl that I'm taking care of. She's not breathing.
Do you know how to do CPR?
Yes, I am. I've been trained. 1,
Okay.
2, 3.
Continue with the CPR. We have units on the way now.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19.
cardiac arrest, prompt activation of EMS, and immediate CPR offers the greatest chance for survival. If safe, tap or squeeze shoulder. Ask loudly, "Are you all right?" If unresponsive, activate EMS, and if available, get an AED. Check for normal breathing. This child is unresponsive and not breathing normally. Begin CPR immediately. Locate the proper hand position and compress the chest at a rate of 100 to 120 times per minute. After 30 compressions, give 2 rescue breaths. Do this quickly in less than 10 seconds. Return to compressions and perform ongoing CPR cycles of 30 compressions and 2 rescue breaths. Quality matters. Compress hard and fast, and allow the chest to fully recoil to its normal position after each compression. Be sure rescue breaths are effective by looking for chest rise. Attach an AED immediately if one arrives. If a shock is not indicated by the AED, immediately resume CPR.
No shock advised. Be sure emergency medical services have been called.
Continue to follow the AED's voice instructions. Don't stop until the child shows signs of life, another provider or EMS personnel take over, or you are too exhausted to continue. Do the best you can. A child in cardiac arrest will not survive without help. Nothing you can do can make the outcome worse. The steps for infant CPR are very similar to child CPR. If it is safe, tap the foot. Yell loudly to startle the infant. If unresponsive, activate EMS. And if available, get an AED. Check for normal breathing. This infant is unresponsive and not breathing normally. Begin CPR immediately, starting with compressions. Locate the proper finger position and compress the chest at a rate of 100 to 120 times per minute. After 30 compressions, give 2 rescue breaths. Do this quickly in less than 10 seconds. Return to compressions and perform ongoing cycles of 30 compressions and 2 rescue breaths. Compress hard and fast, and allow the chest to fully recoil to its normal position after each compression. Be sure rescue breaths are effective by looking for chest rise. Attach an AED immediately if one arrives. If a shock is not indicated by the AED, immediately resume CPR. Continue to follow the AED's voice instructions. Do not stop until the infant shows signs of life, another provider or EMS personnel take over, or you are too exhausted to continue. Immediate high-quality CPR and defibrillation with an AED can double or even triple the chance for survival from sudden cardiac arrest. Performing CPR on an adult is very similar to performing CPR on a child. If safe, tap or squeeze shoulder. Ask loudly, "Are you all right?" If unresponsive, activate EMS, and if available, get an AED. Check for normal breathing. This person is unresponsive and not breathing normally. Begin CPR immediately, starting with compressions. Locate the proper hand position and start compressing the chest at a rate of 100 to 120 times per minute. After 30 compressions, give 2 rescue breaths. Do this quickly in less than 10 seconds. Return to compressions and perform ongoing cycles of 30 compressions and 2 rescue breaths. Compress hard and fast, and allow the chest to fully recoil to its normal position after each compression. Be sure rescue breaths are effective by looking for chest rise. Adults are more likely than children to need defibrillation. Use an AED immediately if one arrives. Turn the AED on to begin voice instructions.
Remove clothes from patient's chest.
Adhere the defibrillation pads to the bare chest. Allow the AED to analyze the heart.
Analyzing heart rhythm. Shock advised.
If a shock is advised, make sure no one, including you, is touching the person before delivering the shock.
Stay clear of patient. Press the flashing orange button now. Shock delivered.
Immediately after a shock is delivered, resume CPR, starting with compressions. Voice instructions and additional analysis by the AED will guide you through further care. When another person is available to operate the AED, do not stop CPR. Continue compressions as best you can until the AED is ready to analyze the heart rhythm. If a person clearly responds, stop CPR and place the person in the recovery position. Leave the AED on and attach in case cardiac arrest returns. Do not stop until another provider or EMS personnel take over, or you are too exhausted to continue. Secondary cardiac arrest due to drowning is one of the leading causes of deaths for children. Often, a child that has drowned and is not breathing may respond quickly to only a few rescue breaths. Change your approach slightly to give rescue breaths earlier. If the child is not breathing, begin CPR with rescue breaths instead of compressions. Perform ongoing cycles of 30 compressions and 2 rescue breaths after that. Always get an AED if one is available. Dry the chest before applying pads. Do not attempt to remove water from the airway or lungs using abdominal thrusts. There is a high chance a child who has drowned will vomit during your care. If this occurs, quickly roll the child onto her side and use your finger to clear the mouth. If a child begins breathing normally, place her in a recovery position. Monitor the child and provide any additional required care. Compression-only CPR for adults is being widely promoted to people who are not trained in CPR. If you are unable or unwilling to perform rescue breaths, you should provide high-quality, uninterrupted compressions at a minimum.
Commonly, more than one trained provider is available to help when a cardiac arrest occurs. Providers can work together to improve performance and reduce interruptions. CPR is tiring, and switching providers about every 2 minutes helps to maintain CPR quality. Communicate about the switch ahead of time. Coordinate your actions to switch smoothly and quickly. Prior to the arrival of an AED, switch at the end of a CPR cycle while the person who is going to move out is giving rescue breaths. The new provider can get into position to start compressions immediately. When rescue breaths are completed, immediately resume compressions.
Stay clear of patient. Analyzing heart rhythm.
When an AED is attached, switch while the AED is analyzing the heart, which occurs about every 2 minutes.
No shock advised.
After a shock is delivered, or if no shock is indicated, The new CPR provider immediately starts compressions.
Stay clear of patient. Analyzing heart rhythm.
When 2 or more providers are present, simply take turns doing CPR.
No shock advised.
Choking can occur when something solid, such as a piece of food or a small object, enters a narrowed part of the airway and becomes stuck. On inhalation, the object can be drawn tighter into the airway and block air from entering the lungs. A forceful thrust beneath the ribs and up into the diaphragm can pressurize the air in the chest and pop an obstruction out of the airway. Compression of the chest over the breastbone can also create enough pressure to expel an object. Young children are particularly at risk for choking because of the small size of their air passages, inexperience with chewing, and a natural tendency to put objects in their mouths. To provide the appropriate care, you must first be able to recognize the difference between a mild blockage and a severe blockage. With a mild blockage, a child can speak, cough, or gag. This type of blockage is typically cleared naturally through forceful coughing. Allow someone with a mild blockage to try and resolve the problem on her own. Stay close and be ready to take action if things worsen.
Hi, are you having fun?
Yeah.
Why don't we have some lunch?
I want to go play.
I think you need to eat something.
But I want to go play.
How about you eat a couple of grapes and then you can go play?
When a severe blockage occurs, a child cannot take in enough air to dislodge the object. Signs of severe obstruction include very little or no air exchange, the lack of sound, and the inability to speak or cough forcefully.
Are you okay? Are you choking?
The child may hold her hands to her throat while attempting to clear the obstruction. Do not hesitate. A child with an obstructed airway requires your help to survive.
Are you okay? Yeah? Just take it easy.
If you suspect a child is choking, ask, "Are you choking?" If the child nods yes or is unable to speak, cough, or cry, act quickly. Stand or kneel behind the child. Reach around and locate the child's navel with your finger. Make a fist with your other hand and place the thumb side against the abdomen, just above your finger and below the ribs. Grasp your fist with the other hand. Give a quick inward and upward thrust. Each thrust needs to be given with the intent of expelling the object. Repeat thrusts until the child can breathe normally. If the child becomes unresponsive, carefully lower her to the ground. If not already done, have someone activate EMS. Begin CPR starting with compressions. Look in the mouth for an object each time before giving rescue breaths. Remove any object seen. Continue high-quality CPR until the child shows obvious signs of life or another provider or EMS personnel take over. The care for an adult with a severe blockage is the same as for a child. When someone is clearly pregnant or obese, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist on the center of the chest. Grasp your fist with your other hand and thrust straight backward. Try not to put pressure on the ribs. If you are choking and alone, try pressing your abdomen quickly against a rigid surface, such as the back of a chair. If one is not available, attempt abdominal thrusts on yourself. Since infants do not speak, it may be more difficult to recognize choking. The sudden onset differentiates this from other breathing emergencies. Signs include weak, ineffective coughs and the lack of sound, even when an infant is clearly attempting to breathe. If you suspect an infant is choking, act quickly. Lay the infant face down with legs straddling your forearm and with the head lower than the chest. Support the head by holding the jaw. Using the heel of your other hand, give 5 back blows between the shoulder blades. Next, sandwich the infant between your forearms and turn her onto her back, with legs and arms straddling your other arm. Place 2 fingers on the breastbone just below the nipple line and give 5 chest thrusts. Alternate back blows and chest thrusts until the infant can breathe normally. If the infant becomes unresponsive, gently place her onto a firm surface. If not already done, have someone activate EMS and begin CPR. Look into the mouth for an object each time before giving rescue breaths. Remove any object seen. Continue CPR until the infant shows obvious signs of life or another provider or EMS personnel take over.